All right, everybody. Thank you so much for being here. It's really an honor and a pleasure for me to be a board member of Ellie's Rainy Day Fund. And I want to thank Julie for founding it to begin with, and all the other board members, and especially thank all of you who are big supporters of Ellie's Rainy Day Fund. We couldn't do it without you. And we really, really appreciate this. So this is our gift to you, and hopefully it's helpful and you get some good tips. So I've got a PowerPoint and I'm gonna just go ahead and share it. So give me a second and we'll get going here. Okay. So hopefully everybody can see that all right. And what we're going to really focus on, there's so much on essential oils out there on the internet. It just boggles my mind. So I wanted to really focus on how I've been trained and what I think is safe and things that are effective, and help you actually have tips so that you can start tonight or tomorrow and start using some oils and have resources. And I started using oils back in the 90s. So I've been doing this a long time, and we'll talk about some of the resources and where I learned from. So let's start with the basics. What is aromatherapy? And it's been around for thousands of years. You know, it goes back way back and even mentioned in the oils of the Bible, and all kind of ancient traditional healings talk about oils. But it was in the 1900s that it became used in more of kind of a conventional medicine way. And it really happened in France. And so in the early 1900s, they started using it for humans. And then about in the 1940s is when it really started gaining acceptance for using aromatherapy in animals. And so what are we talking about when we say aromatherapy? So we're really talking about essential oils for some type of therapeutic effect. Not just, you know, the nice smelly thing that you would put on your body, whatever. We're talking about, we want to really get an effect that helps that human or that animal. And the essential oils can be made from any part of the plant, all the way from the leaves to the bark of a tree, from all aspects of the plant. And there's also something called hydrosols, and those are going to be important later. And those are water-based byproducts of the essential oil that is then distilled. And so, like I said, we're going to talk about those in a little bit. So again, this isn't like synthetic stuff or just like perfumey type of oils. We want things that are very pure and very high grade. And of course, they have their natural smell, and that comes from something in the plant called terpenes. Those are all the molecules within the plant that make the plant smell. Okay, so what does therapeutic grade mean? And there's even a lot of buzz out there about there's different levels of therapeutic grade. And I think that's actually true. We know that when we're looking for an essential oil, we want to make sure that the plant is handled with care, it's harvested at the right time, that it's organically grown, that people know what they're doing as they're processing it. They're not using chemicals, and they want to, you know, distill these at a very low heat, because heat can destroy a lot of properties of plants, whether you're talking about herbs or essential oils. It can really, really wreak havoc on the plant. And then you want to look for a company that will measure, you know, by gas chromatography. That's just a fancy way of saying, okay, this amount of oil is in that batch, and we know that we have the proper amount of oil there, and we know that it's pure. It's not messed up with any other kind of oils or any contaminants of any kind. So how would we use the essential oils? And again, you're going to read a whole lot of different ideas out there. Many practitioners will tell you to put a little bit of the oil in the palm of your hand and then just rub it together before you put it on the animal or the person. That's called activating. Do I find that you have to do that? No. In fact, I very rarely even think about doing it. One thing I will say that the way I learned, and I, over all these 25 years or so, I really feel that this is important. Less is usually more. And so usually what I will do is layer it on. So if I find that there's 2 or 3 oils that I might want to use on a particular animal or myself, I'm going to use the first one, kind of give it a few seconds, and then I'm going to use the second one. Um, there are some cases where I will blend them first, and we'll talk about one kind of recipe that I have for you later. But normally speaking, I'm going to layer them in. And again, less is more. There's some therapies out there from different companies that are, a lot of it's great because they want to introduce you to the oils, but some of it's also marketing. And so they'll have like 10 or 12 oils that they're putting on a person or a horse or a dog. And that just feels like a lot to me. So the way I will use it on an animal is, I'll put it in the palm of my hand, whether I activate or not. And then you can rub on the chest so that they're smelling it. Some practitioners will put it on the foot pads if that animal doesn't mind their feet being messed with. You certainly don't want to do that on a dog or cat that hates to have their feet messed with. Most horses are okay because they're used to getting their feet messed with. And then I'll rub it down the spine, or I'll go down the spine first and then on the chest, either way. So I'm really just going all the way down, letting that oil absorb in and letting the animal smell it. And then different companies will have blends. So those may have several oils in it. So you might look at it and go, wow, she just said use 2 or 3 and there's 6 in there. Well, those are at small amounts, and the whole idea is designed to create one specific therapeutic principle. So you would consider that blend as one. I hope that makes sense. So how else could you use it? If there's a really, really painful joint, you can even drop the oil right over that. Or I'm going to show you a picture of a wound that was healed with oils later. Depending on which oils that you're able to use, you can put it right on the wound. And then, a lot of people like to do diffusers. It just puts it all through the atmosphere and you're inhaling it. And it really cuts down on the smell being too much, because diffusers is usually pretty subtle. So unless you're like right up next to it, you don't get this blast. And again, you want to make sure you get a cold diffuser. It's fine if you just want the pretty smell and you have a candle and you put the oil over it. That's fine. But if we're talking about, I want to diffuse it for a certain property, then you definitely want a very high quality cold diffuser.
Can I ask a question?
Yes, sure.
When you talk about diffusing, is it also good to have the diffusers that have the pad in them that you put the oil on and it doesn't mix with water at all? Are those okay to use as well?
I think so. Yeah, I think there's a variety of them where you can put them, in the water or put them on the pad. And yeah, I think that's just fine.
Okay.
Yeah, yeah. And here's the big controversial question. Here's where you get into all the arguing, um, and whether to dilute the oils or not. And I'll tell you, I am totally amazed at what I have read, and even going to lectures from very good people who are very skilled essential oil practitioners who have developed their own lines of oils. And they will say, never ever put an oil directly on an animal without diluting it. Uh, okay, maybe their oil line, they don't want you to do that with. So I would always be mindful and listen to them. But in the 25 years I've been doing it, I have no problem with putting it directly on the animal. Now, if it's a little kitten, if it's a dog or cat that's very sensitive, especially with cats, they're very sensitive. So I may go for like half a drop, or I might dilute it. Or if the person, and we'll talk about this in a second, if the person is sensitive to the smell, that's a good reason to dilute it. But I really find that this scare tactic of, oh my gosh, and they're going to keel over dead. If you're using a high quality oil, that's just, I've not found that to be the case. So some people will do a 1-to-4 dilution, meaning 1 drop of oil to 3 drops of a carrier oil. A lot of people will just get fractionated coconut oil because it's liquid, or some other high quality vegetable oil. A 1 to 10, if you really want it dilute, you have sensitivities, or it's a teeny little kitten. Yes, I would dilute it like that. Here's some fun research. And when this hit a few years back, I was just like jumping for joy. So, olfactory means smell, right? And so, as a neurologist, I've studied that part of the brain called the olfactory lobe that has the olfactory cells that when we smell something, that sensation goes up and it triggers these cells in the brain, and the brain goes, oh, there's a smell. Well, what they found a few years back is that those cells are really sensory cells, and they have found them in almost many other places in the body. So they found them on the skin, they found them in the kidneys. And so, what that tells us is that when people think, okay, we're crazy because how can you just put this oil on the body, or and it, it heals it? Well, the skin is smelling, the organs are smelling, because those sensory cells are picking up the oil and processing it. And this was a fun study. This all came out of Europe, where they looked at sandalwood in terms of wound healing, and they actually measured these really cool olfactory sensory cells. And so they proved that they're there. What's the one thing about this study that just made me go, oh, yoy? They use synthetics. It's like, I don't know why researchers think that if you make it synthetic, it's better. But anyway, so if it works with synthetics, imagine what real sandalwood would do.
Right.
So let's talk about oils, because everybody's going to ask, well, what are the brands? A lot of times, if I'm doing this in an academic setting, I cannot mention any brands at all, or give up my firstborn child. It's like you have to sign waivers and all that. And I understand. Um, However, I think to be clinically helpful, it's nice to know some really good brands. And there are a lot of them out there. And I apologize if I've left something off here that perhaps one of you use and you really like. And that's great. I always say use what resonates with you. Make sure that it's high quality, they're processing things correctly. It's a good company. And then if that's what resonates with you, that's the ones you use. I cut my teeth on Young Living. That's when I started in the 90s. I still use them. I still think they're fantastic. A lot of people in Central Ohio use doTERRA, which is kind of an offshoot. And there's a whole lot of, I call it essential oil soap opera stuff. It's really quite funny. What doTERRA says about Young Living, and Young Living says about doTERRA. And then down on the bottom, you see the Go to Sauna, and those oils are made by Alexandria Brighton. They're brilliant oils. She's a brilliant aromatherapist, and she was married to Gary Young, who started Young Living. So you have all this intertwined. And then Animal Essential Oils is Dr. Shelton. She's a vet, and she cut her teeth on Young Living and then developed her own line. So those are really good. Original Swiss aromatics, nobody knows about too much in this area because they're from, I don't know why they call them Swiss. They're actually from like the Seattle area. They're wonderful, really nice. And then Natural Options Aromatherapy is from here in Ohio, and they're fantastic. I also have people that have used Camp Wonder or Mountain Rose, and I've used Snow Lotus too. So just to show you that I don't discriminate, my husband was having vertigo today, I think allergies and things. So he got Young Living Thyme, he got doTERRA Citrus, and he got Snow Lotus Peppermint. So he just got a little bit of everything. Alrighty. So why would we use oils? These are all the areas in which they're being researched. So if you were to dive into the medical literature, you would find really good papers in all of these areas. And when I'm talking to other professionals, people say, oh, there's no research. I don't care if it's oils or energy medicine or acupuncture or whatever. I will always say, well, when was the last time you looked? And usually it's never. So I always encourage them to look into the medical literature database, and there is some wonderful work being done. And in the terms of wound care, this is a kitty that I helped with a few years back, and that is an immune mediated wound. So it had surgery 2 or 3 times. They would remove it, take really good margins, then it would come back, and then they take it off, and then it would come back. Tried lots of different medical therapies to try to keep it in check, and doggone, this thing just wasn't going away. And the owner was very skilled essential oil therapist, so she was really open to trying it. And did it take a while? Yes, it did. However, it was the only thing that cured this cat, and you'll see the picture here. Now, this is just as it's winding down. Eventually, all that went away, and the cat did really, really well. So it shows you that there is a therapeutic effect. It had to be modulating all those inflammatory and immune cells in that cat's skin. So why would we not want to use oils? And that this is important. So usually animals will be sensitive more from a standpoint of, oh, I don't like that smell. One of the ways that my mentor would test an oil, she would put it in the palm of her hand, especially working with horses, and just stick her palm out. And the horse, if they liked it, would really just stick their nose right in there, or just kind of back away. So if you sense that they're like, oh, then we know we either have to use a different oil or dilute it. But usually it's just a preference from the smell, versus with humans, we can have like a real sensitivity. So we might get a migraine. Even if it's a therapeutic grade oil, we just might be too sensitive. So it might trigger a migraine or sinusitis. Like, I can eat oils and put oils on, but if I make an oil like tea and I'm really inhaling it and sipping it, I just start getting some sinusitis. Some people are very sensitive on their skin. Now, I would argue that if you use a really, really high quality oil, you shouldn't have that skin sensitivity. Most of that is probably coming from lower grade oils. So it really does come down to how pure is that oil. So let's look at some of the ways, like I was saying, that they have been studied. And it's some really interesting research. So a lot of these oils here that we have been studied in like institutions, whether it's hospitals or nursing homes, where they're diffusing them. So they just have a diffuser in the room, and then they measure the amount of um, disease that they got in terms of infection in their lungs. And they found that the people that were inhaling it had less. And they've also done, if you do what's called a culture, if you've ever had a pet that had an infection, or you did, and the doctor took a sample of it and puts it on a petri dish and lets that bacteria or fungus grow, and then they test different antibiotics on it. And they've done that with oils. So that's a great way to test and say, yeah, it does really kill that bacteria, because look, in the petri dish, there it is. And there's a little interesting story on this, how this happened. For this particular study, the tech in the lab who was, swabbing all the petri dishes and watching the growth and then using different antibiotics, used essential oils for herself a lot. So she was spraying them because she didn't want to pick up anything. Well, when she was spraying them, it would fall on the petri dishes. So by accident, they found that, oh, look, it's killing the bacteria. So then they went and developed real rigorous studies to show that, yes, it takes care of strep, it takes care of staph, it takes care of E. coli, depending on which oil they studied. So that's really, really fascinating stuff. And look at wormwood here. So this is one, I've used wormwood a lot in terms of the actual plant ingesting it, or having my patients take it for certain kind of cancers. But it really helps with a lot of infections, the actual oil, the terpene that comes from the plant. So, and you can see when you're talking about things like MRSA, that can be really very, very, very helpful. So it's great to know that there are scientists out there doing this work for us. In terms of the nervous system, there's so much research and it continues to go on. You know, the big player that calms that nervous system is lavender. That's the one that's been most extensively studied, you know, and we see lavender everywhere, right? So, but we want to again use a high quality lavender because we're not just talking about a smelly lavender eye pillow. We want the real essential oil. And they did a study in dogs several years back, and they put it on the ear of the dog and they measured their heart rate and saw that it dropped. So being able to say, yeah, that's an objective measure. That's just not, I think my dog feels better. No, look at the heart rate came down. So that is very cool stuff. Deborah Wells is a behaviorist over in Ireland, and she's just done some great work. So she's looked at it in shelters, and then she measures the actual calming behaviors. We've used it, it's been measured in car rides. So those dogs that were really afraid to get in the car. And it's again, it's not just trusting the pet parent to go, yeah, I think he was better, or she was better. No, it's like, okay, we're going to measure how much pacing, how much vocalizing, did they stand, did they pant, did they sit down, so that we can get a little bit better objective idea of how they were doing. And they found, you know, these are all statistically significant studies. So very interesting stuff happening. I'll just throw this in here that, you know, as we read studies, sometimes it's difficult, it's frustrating for us professionals that do more holistic things, because there is a bias. And when I was still at Ohio State and we had a whole collaborative on wanting to develop a center to research these things and educate and have clinics and all of that. Um, but you know, everybody kind of shunned us until they realized there was NIH money, and then oh, everybody went to jump on the boat. And oftentimes you don't know what you don't know. So we were really intent on hooking up the researcher with the expert in aromatherapy. For example, there was a study where they measured salivary cortisol levels, and cortisol is a measure of stress. And so what they did is had people smell this lavender for 10 seconds and then measure their cortisol level. And of course, it didn't go up. I could think of 12 reasons why. It was too fast. And if they had consulted with a real aromatherapist, I can't think of any aromatherapist that would have said that's going to work. You know, you're going to need to fuse it. You're going to need to put it on the body. You're going to need to smell it for longer than 10 seconds. So the results should have stated that smelling for 10 seconds doesn't affect stress. But instead, it was this blanket, well, lavender doesn't work for stress. So you see how that can be tricky and frustrating. So luckily, there's researchers that are getting it and doing more rigorous work that makes sense. So let's talk a little bit about a really important topic, and that, of course, is cancer. And one of the oils that's been really nicely studied is frankincense. And they, again, it's not just like, okay, I feel better because I'm using frankincense. They would give it in an capsule, so they're taking it orally, and then they measured these things called natural killer cells, which are our immune cells that help go after bad things in our body, whether it's a virus or cancer or bacteria or whatever. And it increased in that group that took the frankincense. And also then, besides growing bacteria, you can grow cancer cells in a petri dish. And that's a great way to test lots of therapies on them. And so they looked at pancreatic cancer cells and found that frankincense helped kill them. And that's pretty exciting. Now, here's a really important point. If any of you are essential oil aromatherapists now or want to be one, we have to be mindful of how we talk about things. In other words, I don't know what frankincense they used. And also, we have to be careful of not diagnosing or treating unless we have a license to do so. So if I'm taking care of a patient, I have a license to suggest to that client that you give your dog frankincense or lavender or try this with your cat. I can prescribe that. What I can't do though is say the same thing to another human because I don't have a license to do that. So I can educate about it. I can say, there were studies that showed this and might be something that you might look into. If I, was dealing with issues like this, I think I would try, some frankincense. So we can never use words that are a diagnosis or a treatment in the way that we talk. And that's really important because the FDA right now is just looking for it. And rightly so, because with the whole COVID thing going on, there are people that maybe aren't as in with as much integrity. So they kind of make things spin like, okay, this is going to help you fight COVID or prevent that. And we just can't say that unless there's an absolute research study with this particular product saying that it does. So hopefully that makes sense. So other areas of cancer where it's been studied that are very exciting, besides frankincense, geranium, pine, certain pine lines. And so they're looking at breast cancer and how it really slowed down the proliferation, slowed down the ability to invade, induced death. That's all really, really exciting research. So let's talk about our cat friends, because this is, I think, where a lot of the fear of using oils came from. And we have to be mindful here. So this is where education is important. So I'm going to give you resources at the end and also tell you how you can start safely right away. But when we talk about essential oils, there are molecular components to that. And some of them have things called phenols, and some are alcohols. And those are just molecular compounds that require a certain enzyme in the liver to metabolize it. And cats don't have this enzyme. That's why they cannot ever take acetaminophen. So you never give a cat acetaminophen, which is Tylenol. They can't metabolize it. So that's where this started from. Now, if it's a high grade, really pure oil, and a client said, oh, I'm going to put a drop on my cat one time, am I worried? No. Do I want them dousing the cat in peppermint or eucalyptus or tea tree? No, I don't. Nor do I want them to use it every day long term, because that's going to require them to have to metabolize it. So we want to be mindful, but we don't need to worry too much, because I'm going to give you the list of oils that are safe in a cat. So you'll have that list. You'll know exactly what to do. And that blend right there, I realized was in the picture, that lavender chamomile. That's a Go Dasana blend, Alexander Brighton. And that one is amazing. It is just, it's got a great smell, very calming, really wonderful. Okay, so let's talk about what's good for cats. And all hydrosols, remember I talked about hydrosols at the beginning, those are water-based. So they take the oil and then they keep working on it and they make it water-based. And if it's water-based, it's not going to have the same effects. So you don't have to worry about the metabolism. So hydrosols are kind of hard to find, but they're wonderful if you can. Now, if you can't and you want to stick to oils, the list that I have there is they're all safe. So look at two big ones on there, frankincense and lavender, very, very safe for cats. Helichrysum is an oil that is just, it's a little pricey. So is frankincense, but I'll tell you, those two oils are just wonderful. There's a Young Living blend called Valor, but I put the oils that are in it so that if you used another company or there was another blend that was similar, or that, okay, these oils are fine if I wanted to use this on my cat. And it was blue tansy, which is great for pain, or you had a rosewood, or you're okay to use that on your cat. You do not have to worry. Okay, other species. Birds, be really cautious, really cautious. I am not an avian practitioner. I always refer to Dr. Barb Oglesby, who's like my hero of birds. And essential oil therapists have used them in around parrots, but you just want to diffuse and not right at, like, don't spray it right into the cage, but just have it near, like a couple feet back. And you don't want to use some of these oils. Think about them kind of as a cat. So the really intense oils like melaleuca, tea tree, you wouldn't want to do that. I wouldn't do peppermint. I wouldn't do eucalyptus. Again, lavender, frankincense, things like that would be great. Large animals do fantastic with oils, whether it's a cow, whether it's a horse, sheep, goats, they really do well. They love them. And so let's talk, in case there's any horse people out there, or horse people. If your horse is starting to colic, obviously we're going to call the vet right away, right? But we have something to do in the meantime. Now, carefully, your horse, whether they're really colicking and kicking, be careful. Obviously, you got to keep them walking around. We know all those things. But you can take some peppermint, or if you use a certain company that has a digestive blend, all the oils are fine in horses, so you don't have to worry. So if there's a nice digestive blend, which guaranteed has peppermint in it, usually ginger, fennel, you can put that just right in the mid back on top. If it's safe, you can rub it on their abdomen while you're walking around and you're waiting for the veterinary care to come. So that can be really very, very helpful. You can use it for joints, like we talked about. You can put it right over a joint, whether it's a dog or a cat, or horses really do very well with that. I saw a horse once. If I didn't see it with my own eyes, I would not have believed it. This horse had just the stiffest gait in front I'd ever seen in 30 years. And so it did get some energy work, which helped. But it was a blend of the copaiba and the pain specific blend that practitioner was using. And copaiba is a plant that is very similar to hemp that CBD comes from. So now it's the buzz. I've used it for years, loved it just for the fact that it's a great plant. But now, because it affects the endocannabinoid system, which is the system of our body that CBD affects, it's a big deal. And it acts in a couple different ways. It has its own pain relieving properties, and it takes whatever other oil you're using and helps pull it in deeper. So that's one where I would put it together, the copaiba and a plain pain blend together, and then rub down on the joint, and for a horse just to really massage all the way down. And that's what this horse got. And I could not believe the gait afterwards. It just, again, if I didn't see it, I wouldn't have believed it. It was just so much more, could really stretch out. And it was just so nice to see. So that's the one time that I will definitely put them together. Here's the second time that I'll put them together. So if you have a pet, whether it's a dog with a neurologic problem like neck, like a wobblers, or a horse with wobblers, seizures, any degenerative condition, I like these two oils together. This is where I will blend 1 drop of each in the palm of my hand. Now, that clary sage, depending on what brand you use, can be really intense. Not so much for the animal, but for the person. So this would be one that you might want to take a drop of each and then dilute it a little bit, just for your own, peace of mind. And it's like, whoa. Or you can take a little bottle and, measure it out, do a drop of each, and then 4 drops of carrier oil to each one. So just keep diluting it till it feels like a good smell to you, because it's going to work. It's going to work whether it's diluted or work whether it's straight. So you don't have to worry about that. And so you really are just going to massage it right behind the back, right where the neck hits the back of the head, and then a couple of inches up above the tail, whether it's a dog or a horse or a cat. And especially if it's a cat, you are definitely going to want to dilute this. And so you can do it, if they're having an acute episode, acute wobblers or seizures, you can do this once or twice a day. And then if you really want to help kind of have something to help care for them, you can do this once or twice a week just to kind of keep the energy flowing and keep the nervous system calming. Clary sage is also actually great for women as they get older. So that's another use for clary sage. Here's a horsefly recipe. So if you do have horses, you have friends at horses, this works really, really well. If it's really humid where you are, you might need a couple extra drops of each one, just because the air is so heavy. But this one works really well. And the purification is actually a Young Living blend. So you can do it even if you don't have that Young Living blend. You can do it. I've done it with even a handful of these, not the whole recipe. And I found like I really like the citronella and the clove and lemongrass, and a little peppermint. And a lot of times I'll add in a little lavender, just to kind of make it smell better. But this really can be very, very helpful because we know how horses deal with flies in the summer, and you're always spraying something. You wonder how much. Sometimes you need the real stuff. But in between, it's nice if you can put something on them to keep those flies away. So here's some references for you. And especially if you're finding an interest that you want to learn more, and become a practitioner, there is this association of holistic aromatherapy, and it's really going to be focused more on people, which is great because we're people. So we learn for ourselves or for other people. They even have a journal and they have education programs. It's really wonderful. They have an alliance, a separate alliance, so you can join that. And then a really nice place to go is this National Center for Complementary and Integrative Health. And that is a subset of the NIH, which is like the gold standard of scientific research. And so they felt it was important enough to look at integrative modalities, holistic modalities. And so part of their website is really designed for people to come on and just search, okay, essential oils for migraines or things like that. And then they'll give you, okay, there was this study or this is what's recommended. So it's a really nice resource to go and look these things up. When we're talking about animals, Melissa Shelton was the one that created her own line, the Animal EO, and she created a veterinarian's desk reference. And yes, she said for us, but it's written such that you do not have to be a veterinarian to appreciate it. And I mean, it is really detailed, really, really detailed. Now, this she wrote before she created her own line. But when you're using lavender versus lavender versus lavender, it's okay. It's if she's talking about blends from another company, you have to kind of say, all right, what oils are in there, and is there something that matches that? I think the person that truly knows more about essential oils and animals is my mentor, and that's Carol Comator. And I started studying healing touch for animals, which is an energy therapy. And she brings in essential oils right off the bat. And you don't necessarily have to study healing touch to learn oils from her. She has her own kind of group, her team, and she does a lot of training. And she's just brilliant. I mean, she's brilliant. So she's a great resource looking up on that website. A nice book it's had a couple editions now, that it's paperback. It's not expensive. It's called Holistic Aromatherapy by Kristen Lee Bell. I really like this book. It's simple, it's easy. So, and you don't have, like Melissa Shelton's is kind of pricey. This is a really nice basic one to learn some things. And I really, really like it. And then from a veterinary standpoint, the first aid with vet med aromatherapy also could be read by non-veterinarians. So Dr. Brandt wrote that, and it's got some nice kind of common sense things in it, and it's not real pricey. Now, there is a Veterinary Medical Aromatherapy Association. Obviously, you got to be a vet to be part of that. However, if you're discussing this with your vet and they might be interested, he or she might be interested, so this is a resource that you can give them. And so with that, I'm going to stop sharing my screen so that we can maybe do some questions and answers. And I knew my pointer would die. It tends to do this. Hang on just a second. Great. My pointer does this weird thing where it goes away, and then I'm doing this mystery spin. So, okay. And actually, there's one more book I want to show you. So just hang tough while you're thinking of your questions, the folks that are live. This just hit me when I was doing the other references, and I thought, oh yeah. So this is an essential, oh, it's all backwards. So it's essential oil desk reference for animals. So you would Google it, and it's from a corporation called Life Science. And it's really, really nice. So again, essential oil desk reference for animals. So you can see it kind of on the pictures on there. And it just has, you name it, it's got it. So, and I think that's what can be confusing, because you have all these oils and all these indications. So here's my practice tip to you. Besides picking a resource or taking some classes, you can use lavender and you can use frankincense. And you can use them on cats and dogs and horses and pigs and everything. And they're so broad spectrum. They can be calming, they have anti-infectious properties. We talked about frankincense and how the studies are in cancer. It just wound healing, so if there are 2 oils that you start with, those are your oils, and you can use them safely, and you can get a lot done with those while you're learning some of the other things. Okay. So let's talk about questions, and hopefully those of you who are watching virtually, if you're thinking of the question, somebody's going to ask it and you'll get the answer. So any questions?
I do.
Okay, Maggie.
So I have a cat who, when we have a lot of strays in our neighborhood, and he's not an outdoor cat, he's an indoor cat.
Mm-hmm.
And when he sees the strays in our yard, it makes him anxious, and he sprays.
Yeah.
And is there another oil besides lavender that I could use on him to help calm him? We use hemp oil during the summer, especially, is the worst time.
Yeah.
Now it's cooler, he gets a little better, but he still does an occasional spray.
Right. Right.
So we don't use the hemp oil on him so much in the colder months.
Mm-hmm.
But lavender, that might be, I'm just wondering, besides the lavender, I could use that on him sort of in the winter on the outside, of him, not internally.
Right.
But is there
Right.
another oil as well?
Yep, you can use lavender, or you can diffuse it around an area, especially if like there's a certain window the other cats come up to, you can diffuse it there. There is a blend from Young Living that I absolutely adore. It's called Peace and Calming 1. Like there was a shortage of one of the components of it. And so they developed Peace and Calming 2, which is fine, but it ain't Peace and Calming 1. And I'm telling you, that's
about
there. It is fantastic for all of these kind of situations. They've used it in barns to help the cattle be calmer, helps people be calmer. I think doTERRA has a similar one called Serenity, something like that. So, but that is my go-to, and it's safe, and I love that stuff. Just love it. So.
And then I was going to ask you, so my friends who had the fire,
Yeah.
Lavender would be a good thing to kind of help calm their cats down.
Yep. And the Peace and Calming. That was the one that when you were talking about your friends in the fire, that it was like, boom, that I would go right for that one. And so, and even things like adding in frankincense too. Let's say you don't have access to that particular blend. Frankincense in it has a different way of kind of calming and clearing things. So that is another great oil just to help kind of just calm the environment. You can mix it with lavender. So that's another one. Again, it's very safe. Citrus oils, you have to be more careful in cats, but let's say it's a dog or horses or things like that. Citrus and bergamot can be very uplifting, and besides calming, you want to kind of uplift that mood. So those are other good ones that you could use too in a dog or a horse, or yeah. So
And would those, would the peace and calming and the frankincense need to be diluted?
no.
No, okay.
I mean, unless the animal, like, unless you wanted to use it right on the animal and they were like, "Ugh, that's too strong,"
Right.
then you dilute it. But if you're diffusing, yeah, diffusing it kind of dilutes it. But yeah, so it just depends how sensitive the animal is. But from a toxicity standpoint, it doesn't have to be. So,
Okay.
yeah, yeah.
And then lavender for dogs on their joints.
You could put it on their joints. I would also add in something like if the joints, and here's the where we have to be careful with diagnosing things. So if you had a friend or yourself, if they had discomfort is not a diagnosis. Pain is actually, or arthritis is a diagnosis. So if there's discomfort, stiffness, yeah, lavender can be calming, frankincense can be calming. Pairing it with a copaiba or something like a balsam fir. Balsam fir is great because it can also be used in cats. So a balsam fir or a blue tansy, those are really good pain relieving oils that just boom, you just go, oh yeah, that feels good. And a little tidbit, this is one that is more for people, unless the dog has, and I wouldn't use it in cats, but if the dog has a big cone on for whatever reason, eucalyptus, what it does is it just dilates those blood vessels. And so, if you go to like a fair and they have booths or something like that, and they're like, oh, we have this great magic pain reliever for $40 in a little spray bottle. And when you look at it, it's eucalyptus and water. And what eucalyptus does, and that's the icy hot kind of things, menthol, eucalyptus dilates those blood vessels and you immediately get rid of the pain. So that's more a tip for people because we're not going to lick it off. For a dog, I worry you don't want them to turn around and lick it off because that's going to be too hot of an oil. It's not going to taste good. Whereas if they lick lavender or frankincense, I'm fine because those things can act. We didn't go into a lot about taking oils internally, but there are some that are very safe to do that with. So I don't care if they lick lavender or frankincense. I don't want them to burn their tongue on eucalyptus. So, but for us, that's a great one to just get a little eucalyptus, little spray bottle of water, your neck's hurting, joints hurting, just a couple of sprays, and then what you can do is mix that eucalyptus with a little blue tansy, copaiba, a fir, and make that as put it right on there, and that just nice stuff, yeah,
Mhm.
nice stuff.
Do you ever use Amrita oils, AMRITA? I know they're GC tested. And
Oh, okay. No, I have not heard of those, so
you
I'm gonna
look that
write that down.
they are really super high grade oils, and
Mhm.
they're almost half the cost of doTERRA and Young Living.
Nice.
And
Yeah. How
yeah,
how is that spelled again? UM.
AMAMRITA, Amrita.
Okay. Thanks. See, it's all these nice little tidbits, and
Yeah.
again, it's like using what speaks to you. And when I'm testing an oil company, I usually will grab their frankincense. That just gives me a feel. I'm married to an Italian. It's kind of the similar thing. Not that I can ever drag them to an Italian restaurant. You're never going to catch them at a chain restaurant. But if there's a mom and pop place that he's going to go to, he's going to test them out by their eggplant parmesan. So he's got that, and I test them out with frankincense. So it's fun to explore these different companies and see, and one they may be all pure, and one person goes, "Oh, I just love these." that's what you use, and somebody else be like, oh, I like these. That's what you use.
Right, right. Yeah.
Yeah. So any other
So,
questions?
yeah, so where does something like colloidal silver fit? It's not an essential oil, right? What is it?
No. Colloidal silver is I guess you'd call it it's not really a supplement, but it's a product made from silver. It's diluted way, 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 way down. And the studies, over the years, there's a lot of controversy over it. There are some practitioners, even integrative, functional doctors that will say, never take it. You should never ingest silver. And then you have other holistic practitioners will say, oh, yeah, I take it every day. It has anti-infectious properties. So antibacterial, antiviral, antifungal. People who have chronic sinusitis will make a colloidal silver nasal spray, or you can take it internally. Again, being really mindful and talking to an expert that uses it so you know what product to use and how much to use. And it's one of the more controversial ones out there. And I found it to be helpful. I have used colloidal silver before, and felt pretty good. So, but that would be definitely one you just don't want to walk into any store and buy
Right,
it off the shelf.
right.
Yeah, unless you.
Well, I realized, I mean, I've been mixing it with some of the other stuff that I've been giving Ellie for years.
Yeah, yeah.
So it was like, well, it's not an essential oil, but what is it? And should she still be taking this?
Yeah. Yeah. And when people are comfortable with it, and it's just like that. Some animals, some people will have taken it for years and done really well. But because of Ellie's condition, it's the concept of trying to get ahead of keeping that bacteria down, or a virus, whatever. It's like, let's just keep all those infectious agents down. That's specifically what it's used for. Yeah. Yeah. So any other questions or comments?
Well, yeah, I'm just thinking about, I mean, Smudge has some issues with mainly lumbar spine, some thoracic. So she has some pain sometimes.
Oh, okay.
I mean, she gets her acupuncture and stuff, but she still is kind of, I don't know, kind of stiff sometimes and ouchy if you touch her in certain places.
Right.
Would lavender or frankincense be a good thing to put a little on those areas?
Yeah, you could. I would probably, I think you probably get, well, either you get a nice reduction in inflammation with lavender or frankincense, and then balsam fir is one that is a great pain reliever and it's safe in cats. So you could, try each one by itself and get a sense if she's moving better or feels better. Or you could say, okay, I'm going to make a blend. I'm going to do a little drop of lavender, drop of frankincense, drop of balsam fir, and then maybe dilute that, because that's going to be pretty intense, right? 3 drops, it's going to be smelly. So then dilute that, and then try that blend and see how she feels. So those are, great, great oils that would be very safe and hopefully helpful. Yeah.
What about hot spots on dogs?
Yeah, hot spots, lavender, 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 and a little frankincense too. And this is where people will mix with either, if it's not a hot spot where it's oozing and all that you would want to just mix with a little water and spray it on. If it's just open, and you do want to dilute that, and you want to test it in a little area and make sure, because even though those are calming oils, when the skin is inflamed, anything touching it might just create some pain. So those I would dilute like at least 1 to 10 and do a little spray in an area. As things are crusting up and drying, or if it's an area that's being bothered and the skin hasn't broken, that's a great place where you take solid coconut oil that you get at the grocery store and put a little lavender, a little frankincense on that and rub it on that area, and that will help prevent the skin from deteriorating. And And, obviously you're trying to keep the animal away from licking it, but should they get to it, fine, not going to hurt a thing. So yeah, those are 2 really good oils for that.
And then my last question is, my dog gets some allergies. I suspect it's allergies in the grass.
Mhm.
And is there something that you recommend for that?
That's a tough one. Oil wise, I'm not thinking of one that's just pops out at me, unless it's, again, the allergies create a skin issue. And then, you want to work with the underlying allergies, whether it's from a conventional with a dermatologist or homeopathic or things like that. And then if they're messing with their skin, you can use oil on that. But in terms of actual anti-allergic oils, trying to think if something pops up. I'll do my reference book and see if I come up with something, then I can get that to Julie and she can get it to you. So I'll see what the big Bible says here. So
Thanks.
you're welcome. You're welcome. So, well, thanks
Excellent.
everybody. Yeah, this was great. And again, we just so appreciate everybody's being supportive of Ellie's Rainy Day Fund. And we hope to do more of these. So, so thanks for listening in and joining us.
Thank you, Sue. I learned so much today. I really enjoyed this.
Good.
Thanks,
Good.
Julie.
Yeah, thanks, Sue. I did too.
Very nice.
This was great.
Oh, good.
I
Good.
appreciate
Good.
you spending the time. And
Oh, my
I think this will
pleasure.
be a great resource for us to send out to the folks that didn't get to come.
Yeah.
And yeah, because I think Sunday night, I think wasn't great for some folks, even though I thought it might be,
Yeah.
might be a time people could come. But
Yeah.
I'm sorry
Yeah.
about the background noise. Ellie is having PT behind me.
Oh, I didn't even hear it. I didn't pick it up. So,
Oh, good.
yeah, so
Oh,
we're good.
Okay.
Yeah.
Okay.
And so this way we've got it recorded. And hopefully, like I said, folks out there at home, if you had a question, hopefully you got it answered and got something useful out of it.
Yeah.
So.
Or if somebody's really dying to know something, they can email me and
Yes.
I can ask you.
Absolutely. Glad to do it. Yeah. Yeah.
Perfect.
Okay.
Perfect.
All right, everybody.
All right. Well,
Thank
thanks again.
Okay. Have a good
evening,
coming up
everybody.
week. All righty. Bye-bye.
Bye.
Bye-bye.